Okay, so here we are. Tom Ryan with HPM and Ginette Velez from Devoted. And we're going to have a chat today to get from Devoted's perspective why Devoted is a great thing for agents to have in their portfolio. And I'm going to say in the beginning of this little chat that my wife and I are both members, not just admirers of Devoted, but members of Devoted, and our experience has been fabulous. I've gotten $150 towards my Apple Watch. I've gotten, we're on a PPO plan. I've gotten my over the counter. My wife got a call the other day from Devoted. And by the way, when Devoted calls you, they say, hey, this is Ginette from Devoted. They don't say, hey, this is Devoted. Saying, by the way, Lori, I've noticed you haven't fully used your over the counter benefit, and you might want to take a look at that. That really could be a benefit to you. So I'm here to say that what they tell you about the member experience actually is something that we've experienced and we've enjoyed, and we're having fun with it. So with that, here's Ginette. Why Devoted?
Hi, good morning, everyone. My name is Ginette Velez, as Tom said, from Devoted Health. I'm the sales manager here for Orange, Osceola, and Seminole County. And thank you for allowing me to talk briefly about Devoted Health. And Tom, I just wanted to ask you, did you get to order your PERS device?
Well, that's why you use the Apple Watch, because the Apple Watch will do the same thing.
Okay, awesome. Okay. Well, I just wanted to make sure you're using all of your benefits. And that's one of the things that we're going to talk about today. I just wanted to say that those of you that are joining us today, maybe you've heard of Devoted, maybe you're not sure of who we are. So today I'm going to kind of give you some bullet points as to why Devoted Health. And to let you know, we know that it's difficult to enter a market that's established for a very, very long time with all of the big players. I've come from Freedom Health previously, 7 years in this market. And I know it's not easy for a new plan to enter the market, but we have been here now. This is going to be our 5th year, going into our 5th year. And we have grown tremendously. We believe in boots on the ground, grassroots marketing is the best way to get to the people, and it's working for us. And then we'll talk about that with some of the agents that may be wondering what I should do to get kick-started. And we have lots of opportunity for you to do that with our boots on the ground community outreach specialists. We have 3, and we'll get talking about that a little bit later. But for now, some of the top benefits that we have that are available on all of our plans. So to start off with, we have 0 for covered insulin. So this insulin is also covered during the initial coverage the initial coverage limit and the coverage gap. So that's really important. While we are not a chronic illness plan, we do have insulin, including pens, at a 0 copay. So that's available on our Essentials plan, our Prime plan, our Core plan, and our D-SNP plan. And this, as I mentioned, includes needles and pens. Now, there are some medications that we do not cover, but we do cover the alternative. And the nice thing about one of the features on our online medication lookup is that if you list a drug that is not covered, it will provide you with the alternatives. And so there's many insulin medications that have similar ingredients that will take care of maybe Humalog that we don't cover at this time. So it's never an objection for our team when they say, well, you don't have Humalog, we always have an alternative that is available to the member. So we're really happy to have this benefit across all of our plans. And it's very important for people that are spending money on insulin to have this benefit. It's not to say that they're not going to fall into the coverage gap, because of course the retail cost of the drug is applied towards the donut hole. However, they don't have to pay anything until after they get out of the coverage gap. So that's really, really a great benefit for our diabetic members. We also have our Freestyle Libre, which is goes in conjunction with the zero insulin at a zero copay for anyone that may not be able to manage their diabetes. So this is something that the primary care doctor has to give a prescription to the member in order for them to get it. Not everyone will be prescribed a Freestyle Libre from their primary care doctor, but those that cannot manage their diabetes will definitely benefit from this Freestyle Libre, and this again is available on all of our plans. We have really competitive, strong dental benefits. I do want to say up front that we don't have the posts, and the reason for that is we know that it's been difficult for members to access this benefit due to the fact that dentists don't have those procedures, and it's difficult to find a dentist that will actually provide this benefit. So while we want to make the member experience good, we want them to have a great member experience, so we don't provide that benefit at this time due to lack of dentists providing the posts for their for their teeth. So we do have on our DSNP plan an unlimited allowance of dental benefits. So what does that mean? That means that there's no limit as to the amount of dollars that they can spend on their benefits, their dental benefits on the DSNP plan. So for example, while we may have root canals, crowns, fillings, extractions, dentures, it's not unlimited as to the number of crowns they can have, the number of root canals they can have, the number of fillings they can have. Whatever is listed in the dental guide, which is available on our website, those won't cost them anything. So the unlimited is the allowance, the cost, not the actual procedures, which is actually a great benefit. And I'm proud to say that we still have Liberty Dental as our dental provider. And I think we might be the only ones left in the area that has Liberty. And if you have had experience with Liberty, you know that there's a nice provider network when it comes to when it comes to our dental benefits and our providers. So we're glad that we still have Liberty. And we are getting a lot of dentists reaching out to us, asking us to do some events and doing tabletops with them. So that's one of the opportunities that you have as an agent, is to reach out to the dentist in our network and see if you can put a tabletop there. So there's lots of opportunity right now with dental. The Prime plan and the Core plan will provide the members with a $2,000 dental allowance. And what's nice about this is that they will get the preventive measures at zero, and the $2,000 is for comprehensive, which is on top of that those preventive services. So they get a good amount of dental allowance on the Prime and the Core plan. We also have dental benefits for our essentials plan, which will provide them with the money back, the buy down for their Part B. That is a little bit less. It's $750, and that includes including the preventive measures as well as the comprehensive benefit. It's all inclusive in the 750, so they don't get that extra preventive benefit. But of course, we know that when you provide better benefits, richer benefits, there's a little bit less on some of the other ancillary. So, but for the most part, we have a very, very strong dental benefit. The other item would be our OTC benefits. The nice thing about the OTC benefits is that, of course, they can go to CVS. Lots of times, members will complain that CVS doesn't carry all the items in their store. And in that case, maybe it's due to the pandemic, or maybe they just didn't stock up that month. They can call us, or they can order it over the phone. So we can send them those items. CVS is our preferred pharmacy. And I just like to educate the member when they sign up, to let them know, hey, there might be some items that you may not find in the store. And then they think it's Devoted's fault, right? So I like to educate them up front and let them know that when you don't find something in the store, please don't hesitate to reach out to Devoted and have those ordered, or they can order online. It is a use it or lose it benefit. Our DSNP plan is now offering $110 for the over-the-counter benefit. And one of the nice things too is that our transportation will take them to the pharmacy, so they can literally get a ride to CVS and get their OTC items. Another great benefit would be our innovative hearing aid benefits. Now, we know that most companies provide an allowance per ear, and we know that most of the beneficiaries can't afford to purchase hearing aids because there's a limited amount of allowance that they're provided. And we know that hearing aids, are quite expensive. They run between $4,000 and $5,000. And if you're getting maybe $1,000 per ear or $1,500 per ear, that leaves them to spend quite a bit of money. And this equates to people walking around unable to hear everything that they should in this wonderful life, and simply because they can't afford it. So we provide them two options: an advanced set of hearing aids and a premium set of hearing aids. And the difference between the two is that one provides Bluetooth so that they can talk on the phone with their Bluetooth. And that's really an amazing benefit. These hearing aids are really, really nice hearing aids, and they have a zero copay for their hearing aids on DSNP. And so the co-payments go up per each different plan that we offer. So it's depends on what plan they have, but the highest that they can pay is $899 per hearing aid, and that's it. And that is on the Essentials plan. So really, they have a flat, predictable copay for their hearing aids. They know exactly how much it's going to cost them. And quite frankly, it's very, very affordable. So again, another marketing opportunity. We use Hearing USA as some of our providers, and they can actually go and ask if you can do marketing at these hearing stores where they can purchase hearing aids. Great opportunity. It's something that people don't know about enough. And it's a great opportunity for you to do some marketing these locations to let them know, hey, you can actually afford hearing aids with Devoted Health. We have our dental dollars. Devoted dollars. You can find those at devoteddollars.com. Everything that you need to find is on our website. If you're appointed with us, you'll also have your agent portal, which is our one-stop shop to find everything that you need. The Devoted Dollars is something where members can earn up to $135 in a Devoted Health plan for their prepaid cards. It's gift cards that they can use. And these items are great for things such as, for example, we're providing an HRA $25 for our members on all of our plans. So you can actually get a $50 HRA benefit, and your members actually going to get $25 to do the HRA, which only takes about 5 minutes. This is a great benefit for you because you earn an extra $50 when you do any application with Devoted, and it's also a great benefit for your member, and they can actually get a $25 gift card, which is really nice. Members can receive these gift cards to get things done like health screenings, such as diabetic screenings and things such as this, so that they can get actually their reward dollars in the mail in a card and spend it however they wish. So that's really, really a great benefit. The other item that Tom was talking about was the wellness bucks. So we have up to $150 wellness bucks to spend on health and wellness. It's good for gym equipment, fitness trackers, exercise classes. Members pay out of pocket and then they are reimbursed. So for example, if Tom bought an Apple Watch, how much did you spend on your Apple Watch, Tom?
I think $410.
Okay, so we will provide $150 reimbursement to Tom for purchasing that, and essentially you keep the receipt, you fill out a form, and you send it in, and everything is done electronically. So we will send that check out within 5 business days. So it's nice. They can use it for a host of other items. Health, and especially during the pandemic, people were ordering stationary bikes and things such as this, and it's great to have items in your own home, especially for our seniors, if they don't want to go out and exercise and get $150 reimbursement towards that. We also have additional acupuncture coverage. I do want to mention that the acupuncture coverage is for lower back pain. It's restricted to lower back pain. It's for 12 visits beyond what original Medicare covers. And it's a nice benefit to have. It's an alternative to pain medication. So it's a really nice benefit to have in our plan. We have our free medical alert device, which is a very, very popular benefit with Devoted Health. I know that our competitors have come out with this, but we're still strongly advertising this benefit simply because it's free. It doesn't cost the member anything. The item, the actual alert device is free. The service is free. The setup is free. And the monthly monitoring is free. We have some really great, unique items that they can choose from. I know that Tom is using the Apple Watch, but we also have a watch for members. If they don't want to spend the money on the Apple Watch and get reimbursed, there is an actual free medical alert device, which is a watch for the gentleman. And we have a beautiful necklace for women, and it looks like a piece of jewelry, and no one would ever know that they're wearing it. So it's really, really unique benefit there. There's fall detection available on certain devices, and we also have home and mobile versions available. This free medical alert device is going to provide GPS, which is another great benefit. If someone falls, they'll reach out to a Life Station, which is our vendor for this item. And Life Station will determine whether or not it's an emergency. Maybe someone fell down and they were able to, someone to help them up and they're okay. And Life Station will ask them, and then that'll be fine. But let's say they need someone to come and they needed an ambulance to come. We also determine whether or not that is necessary, and emergency services will come and rescue our members. So they have peace of mind. They know that they're safe wherever they go. Maybe they don't have family here. Maybe they travel by themselves. So it's really, really a great, great benefit to have. We also cover ED coverage, so we have generic Viagra covered as a tier 2 prescription, and they can get up to 6 pills per month. The reason, I can go on, but the other reason is our zero medical copays for extras on our D-SNP members. I do want to let you know that our D-SNP plan this year, it covers all the levels of Medicaid. So it's QMB, SLMB, QI1, SLMB plus, QMB plus, MS full. So essentially all of the levels of Medicaid qualify for a D-SNP. Again, we have zero copay for hearing aids on this plan. We have zero copay for personal home care. So personal home care is assisting with activities of daily living, and we provide them with a max of 3 hours a day or 42 hours a year. So this is great if maybe you're taking care of your mom or your dad and you will need a break, and maybe that you want someone to come and maybe do laundry for them 3 hours a day. So I would take those 42 hours and divide them up by 12 months and have a couple of hours provided for help that they may need outside of home health care. These are, again, for ADL. So really a nice benefit. Again, I want to remind you that that plan is going to have an unlimited dental allowance. And then again, the $25 reward for completing the HRA to your member. And then you get $50 for that as well. So there's just so many great things that Devoted has to offer. One of my favorite things is our service. So our service is simply amazing. What we, our leaders formed this company because their parents got sick and they saw the difficulties that they were dealing with and not getting referrals and waiting for authorizations, and they asked themselves, is this really the best that we can do? And so they came to mind to think about this organization as treating our members like family. And so that is our mantra. That is our everything that we do centers around how our members can have a better experience. And that is super important for you as a broker, because you don't want to have to go back and call the member and call the plan and do a 3-way call and waste your time really for things that the health plan should be doing. It's difficult I know when I was doing independent, I always said, hey, call me first. You don't have to say that here. You can say, be confident knowing that your member can call Devoted Health. And we're just built, we're built for a rolling horizon of 20 years. We're not going anywhere. We're not selling. And our in-house platform is built to increase volume. We have they added, we're now at almost 80,000 members from 30,000 in AEP. So we have grown tremendously. Our DSNP in this market has grown amazingly, and we're just super happy and excited to be able to provide these great benefits to our members, as well as the amazing, excellent service. They call one person, they speak to one person. We do not rate our call center on how long they stay on the phone, which is typically something that they're measured by. But we measure them on if they taking care of the member's issue or not. That's how we measure our call center and the people that answer our phones. We call them guides, member guides, so that they can essentially guide them through any difficulties they have and anything that they need. So the service is simply amazing. And that translates for you to write more business. So the last thing I'll talk about is our transportation. Our transportation is unlimited rides to the PCP on our DSNP, on all of our plans, frankly, except for the PPO, are unlimited rides to our PCP, and then we have for the Prime plan as well as the DSNP plan, unlimited to our specialists. We have had, we do offer Lyft and Uber on a case by case. We have found that due to the pandemic, there were less drivers available, and it was causing some transportation issues. So what I like to say is that that's on a case by case, and it kind of still is going on. Sometimes we call and there's not an Uber driver in the area to pick them up. So I would definitely let them know that we have a Levy as our transportation. They can still call within the 72 hours. And if it's necessary for Uber and Lyft, we will make the attempt to do that. They do have to be outside waiting for the driver. So sometimes what happens is somebody will go, let's say, to physical therapy, and there's still a checkout, and the Uber and Lyft are there, and they're not outside, and they'll leave. So just make sure that you educate the member on that, and make sure that they know what they have to do. We will take the member to the pharmacy, the PCP, the specialist, and the gym. So if they want to go to the gym, they can use the specialist transportation visits to do that, and each plan has their own number of specialist transportation visits. It is a 30-mile radius, which is a really good distance for travel on our transportation. And this is going to be available, like I said, on our Essentials, our Core, our Prime plan, and our DSNP plan. There is just one other, as Tom was mentioning, we do have our PPO plan. It's not something that we advertised too much this year, but we wanted to see how it would do, and we did pretty well considering we didn't advertise it that much. It does have dental and vision on the plan, which it can be used. There's an allowance of $1,250 that can be used for any dentist, any vision, and they can pay out of pocket and get reimbursed for that. So it's sort of like a PPO there as well. So I just wanted to let you know that placing your members with Devoted, you'll be quite happy. Your members will be extremely happy. The service that they'll get is amazing, and that's it. That's what I have. That's a lot.
It is quite a bit. One of the things I want to verify, both since I am a member as well as a salesperson involved with Devoted and selling the plans, is that I'm going to tell you that what Ginette has just said is 100% true. as a member or as an agent calling in. As a support person at HPM, I get calls all the time from folks saying, I've been on the phone for 15 minutes. I've gotten transferred 9 times and I have nobody to get the answer from. And you call Devoted, you're going to be talking to a person that says, hi, I'm Bob. What can I do to help you out? And they're going to walk you through what your question is. And again, part of being effective as an agent is minimizing the time that you're taking to do repetitive after the sale task and maximizing your time looking for new clients and making sure that the current clients you have are happy. And Devoted does that, and I can vouch for that. I also can tell you that I enrolled at HPM. We have HPM Shop, which is Connecture, our online enrollment tool. And I enrolled my wife and I on Connecture, and I did the HRA form via Connecture, and everything maybe takes you 10 minutes to do the app with Devoted, and then maybe another 5 minutes with the HRA form, and everything was as good as you could possibly hope for. So just a couple more minutes, Ginette. You've been in the field and you've been selling yourself. Here we are in the OEP. What should agents be doing? You already mentioned there's the possibility at both the dental and the hearing aid, which are great suggestions for those looking for places. You know, how do I market? I need leads. You got to go create your own leads sometime. But what would you recommend for people to be doing here in the OEP to build their business?
Wow, there's a lot. There's so many opportunities for you guys to market. And we know that brokers want 3 things. They either want money, they want leads, or they want opportunity for leads, right? So here at Devoted, we have lots of opportunity to take you by the hand, bring you out to the community buildings, bring you to, we have a ton of CVS stores. We have a ton of opportunities for you. Our community outreach specialists will spend time with you, talk to you, see what kind of opportunities there are for you in your areas. We have 3. One is in Osceola, one is in Seminole, and one is in Orange. And we also have, of course, others in other markets if you're marketing in Lake, Hillsborough, Polk County. So we have plenty of things for you to do. We're constantly generating events. We have food trucks. We have ice cream trucks. We do food bank drive-thrus. We work with our providers. So there's lots of opportunity just with our team. Please don't hesitate to reach out to me. Just going to give you my phone number. It's 407-430-5322, and I will connect you with one of our community outreach specialists so that you can get jump started with that. And you don't have to know everything about Devoted to get going with that, because these girls are licensed, and it's like having another agent at your table. So they talk about benefits. They help you bring people to the table. It's really, really a nice opportunity for you. And just, the main thing, and I'll just give you an example of this. The main thing to do is to get out in the community and grassroots market. One of my agents, I coached her. She wasn't doing well. She wasn't visiting her providers. She just wasn't doing everything that she needed to do. And so, held her by the hand and said, okay, you have to have at least 5 people that you can reach out to in our provider marketing groups that you can call, that you have a rapport with, that you've built a relationship with. And even if that's taking them out to lunch once a week or talking to them on the phone once a week, having those 5 connections that you can just reach out and say, hey, I want to do some events this week. What do you have going on? These provider marketing reps have a ton of events available on their own. And if you connect with them and build a relationship with them, and you have at least 5 people that you know that you can call, and I tell them, call one on Monday, call one on Tuesday, call one on Wednesday, all the way through Friday. And just keeping in touch with them and building that rapport, you will find that there will be lots of opportunities for you in your provider groups. And you don't have to be assigned to a particular provider to work with a marketing group. You can work with anyone. And believe me, these marketing groups want to work with you. So it's so important to get in front of people. And this agent wasn't working with marketing groups, and now she started working with provider groups. And we have something that I tell my agents to all the time is that don't work alone. You can't work alone. You can't go through this by yourself. So why not invite a provider group to your events, and never do a marketing event by yourself, even if it's a tabletop. As long as you have a provider marketing rep, make it a point to have someone there. I call it no doc left behind. That's what I call it. That means that we're not marketing by ourselves. We're 2 heads are better than one. So that's one really, really important thing to do. You have someone to bounce things off of. You have a doctor right there. Let's say someone's coming to you and they don't want to switch their doctor, whatever the case may be. There's always success in numbers. So that's one big thing that you can do. Visit your churches. If you're going to church on Sunday, there is a group there that you can connect with. There is a person there that takes care of coordinating health fairs and takes care of coordinating all kinds of special events, some birthdays and Mother's Day events. Churches are an amazing resource, an amazing place to go to. And chances are you already have a relationship with your pastor, with your priest, whatever the case may be. And so right there in your own backyard is opportunities for you. Make sure that you paint the town red with your information in your own local community. If my dry cleaners doesn't know who I am, or if my grocery store doesn't know who I am, or if my post office doesn't know who I am, how am I going to get any referrals from local places that I go to all the time? So paint the town red, provide your flyers where you can, guerrilla marketing, go wherever you can bring your marketing materials to. You'll find going out in the community, there's lots of opportunity for you. In working, we have great relationships with our senior communities. Wow, we're constantly on their calendar every single month doing something. If you reach out to one of our community outreach specialists, I'm sure that we can bring you to one of our buildings with us. And thinking outside the box and different types of events. Visiting doctors, so important to visit doctors. I know that you guys have a great provider network manager whose sole purpose is to get provider relationships going for you, and that is something you have to take advantage of, an opportunity like that. Visiting doctors, going in there, talking to the front desk, making sure that, they know who you are and they know your face, and do that consistently. Consistency is the key in this business. If I see my doctor this month and I don't see him for 3 months, they've already switched their receptionist and she doesn't know who I am. So you have to go to your doctors every single week. If you have 15 doctors assigned to you and you have a whole month, that's 3 doctors you can visit each week. And consistency, because, okay, we know that doctors don't always give out leads, but the one day that they drop a plan, that's the day. That's your birthday. That's your party day. And that's the reason why you're going in there, because someday they may drop a carrier, or they might want to move members to another plan. And there you are. visiting them every single month, and they get to know you, and they know, wow, we're going to call this person because they've been consistently at my office. They've been coming to me all the time. They bring me cookies. They're super nice to me. And they're trying to grow my practice. So super, super important to have strong provider relationships. And again, you guys are independent brokers. I don't know how you do it with the assignments, but I'm sure you can visit any doctor you want to visit. So you have the world at your fingertips there.
Okay, Ginette, we thank you for that unbelievable amount of information, both on the company and how to market. And we will hopefully promote this and have it out that agents will be able to view this. And we thank you so much for your time.
Thank you. Good luck, and call me if you need me. Have a great day.
Okay.